Well, Dr. Alexis Travis is Assistant Provost and Executive Director overseeing Michigan State University's new University Health and Wellbeing Division. The division brings together 11 departments focused on supporting faculty, staff, and student health and well-being. In leading the new division, Dr. Travis will provide strategic vision and leadership for a comprehensive health and wellness approach that meets the diverse needs of students, staff, and faculty. And Dr. Travis, welcome to MSU and this show, MSU Today.
Thank you, Russ. Thank you for having me on the show.
Start by giving us just a little bit of your background before you came here to MSU.
Yeah, so I'm originally from the UK, born and raised in England, and I've lived in the US 16 years. Moved here with my husband, who's an American. And most recently, I've been at the state of Michigan, working in the Michigan Department of Health and Human Services. I've led the Public Health Administration there. Before that, I led the Aging and Adult Services Agency and was the Bureau Director for Health and Wellness. Prior to that, my family and I lived in Massachusetts, in central Massachusetts, where I was Chief of Community Health for the city of Worcester, which is the second largest city in New England. And so really focusing on how to improve population health, whether it would be at the local level or state level. And then, through my time working in public health, the common thread has really been working on health equity. So figuring out what communities need and meeting them where they're at to get the best or optimal health outcomes.
So what attracted you to this position at MSU at this time?
Yeah, so as I mentioned, we moved here about 4.5 years ago, and during that time, Michigan, I've become very fond of Michigan and this great state. And when this opportunity came up at the university, I was really excited about just this opportunity to set this culture of health and well-being and create something new, building on a very strong foundation of these 11 units, but really having that opportunity to look at assessment and planning and work with the Spartan community to, reach optimal health and well-being here. I really enjoy engaging with communities directly. So working with faculty, students, and staff directly is something that I'm really looking forward to. And even in my early conversations, just looking at the themes that are coming out as we have those conversations and looking at opportunities to fill gaps and build on the amazing services we're already offering.
Cool. So just tell me a little bit more about why you're so passionate about this work.
Yeah, so when I was younger, I mentioned I was born and raised in the UK, but both of my parents were African immigrants. They actually came to the UK to attend university. And so just understanding the differences between different groups and different needs and how that impacts health has really been a passion of mine, working towards, leveling the playing field, figuring out how we can better meet the needs culturally, for example, or in terms of language. Here in MSU, I'm really excited about this really diverse, huge community that we get to serve. I think that there are many opportunities for us to look at. Number one, as I said, making sure that health and well-being is kind of integrated into all aspects of campus life. But beyond that, thinking about the different backgrounds people come here with and how we can really listen and, develop more programming and initiatives to meet those needs. My vision is really to make sure that each Spartan has access to the resources and education, information, and services that they need to really, be able to meet their full potential here.
And you just started to sort of answer my next question, but how do you define health and well-being, and what do you see as the mission of University Health and Wellbeing?
Mm-hmm. Yeah, so that's a great question. And I think, I've mentioned just the diversity in our community at MSU, and that's one of our strengths. But with that, people are coming here from all over the world with different understandings about health and well-being, which can be considered subjective in some ways. So it's important for us as we do this work to really have some shared definitions. The World Health Organization outlines health as an optimal state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. And then for health and well-being, The well-being definition is also something that varies, and so universities across the U.S. have adopted a definition. It's the inter-association definition, of well-being, which is an optimal and dynamic state where people are able to fulfill their full potential. So when we think about that in the MSU community, it's looking at what is academic success, how do we achieve that? If people are not healthy or not feeling their best selves, then it's going to be more difficult for them to reach that academic goal, whether it's graduation or something else. For our faculty and staff, it's equally as important as we facilitate that academic journey for others, and just making sure we're also looking after ourselves during that process as well.
And how would you describe your relationship with the university physician's office?
Yeah, so there has been some restructuring. So previously there was integration of what now is University Health and Wellness and the University Physician's Office. Now we're two distinct units, although we do work closely together. So University Physician is a cabinet member. He's advising the president and guiding senior leadership within the university on all things related to health and safety, included how we respond to COVID and other major threats, as well as making sure we're also meeting statutory responsibilities in terms of state and federal statutes that we're responsible to adhere to. University Health and Wellness is on more of the programmatic side, and so my role as an administrator is overseeing all the programs and the array of services that we provide in those 11 units. It brings together units that were formerly in the University Physician Office, so it's the Employee Assistance Program, the Health for You program, which is health promotion for our staff and our faculty. It also brings together occupational health and travel, which again were in University Physician. And then we have other units like Student Health Services, which is housed in the Olin Health Clinic. We also have the CAPS, which is Counseling and Psychiatric Services, Center for Survivors, which is providing support to people who have experienced relationship violence or sexual misconduct. We have Safe Place, which is the only on-campus shelter for people who have experienced relationship violence or stalking and other forms of harassment. And then we have the Resource Center for Persons Living with Disabilities. And so that's a program area that's seeing a lot of demand right now as we're admitting more students who are living with disabilities and making sure that they have an equitable experience here as well. And so I mentioned health promotion, which is our student-facing education and awareness programming. And then we also have the work-life office, which is housed in our area as well, and making sure that employees have the best possible experience here and that we are following best practices for that supervisor-employee relationship and beyond.
I'm talking with Dr. Alexis Travis on MSU Today. She's Assistant Provost and Executive Director overseeing the university's new University Health and Wellbeing Division. And do you have yet some sort of short-term goals for the division and maybe some longer-term goals?
Yes, Russ. So in the short term, what we're looking at is bringing together those 11 units. It's always difficult when you go through organizational change. And when we look at those 11 units, they've all been following different practices. And so we're looking at policies, practices, processes. But with that challenge comes the opportunity of making it more efficient, really leveraging the data from each of those program areas to make sure that we have a full picture of what the needs are of the Spartan community. So in the short term, also looking at how do we educate the university community about the services that we offer, making sure that we're making those connections as tightly as possible so people know from the beginning of their journey with MSU all the way through the end of their journey that we're here to support them and we have resources, information, and other supports that they can take advantage of. In the longer term, we are looking at how to look at measurable outcomes. And so how can we move the needle on health and well-being outcomes and reaching that optimal state of health? Now, in public health, it takes a little bit longer to see those in terms of our metrics, but we can track things incrementally. I mentioned before making sure that we put our own masks on first, so looking at the health and well-being of faculty and staff. And then also just making sure that when we're looking at that data and we're, assessing health and well-being, that we're really making sure that we have strong campaigns and also leveraging the fact and highlighting the fact that a lot of the time students have healthier behaviors than are relayed in the stereotypes about students. So making sure that we have the accurate information out there. And we are the home of the National Social Norms Center. And so a big part of our responsibility is to do those social norm campaigns and share, what the majority of students are actually doing and the healthful behaviors that we see here on the MSU campus.
And as you pursue these goals, any particular challenges and opportunities you see?
Yeah, there's always challenges when you bring together new organizations. And as I said, we're looking at, how to get onto shared data systems and things like that. But I think the biggest opportunities are really to be a convener, bringing together so many different areas across the university, all focused on health, and outside of our team, also convening others who have programs and initiatives supporting health and well-being so that we're collectively making a bigger impact. And that's a lot of what we'll be doing moving forward, as well as assessment. And I can't go too much into the details, but needless to say, we're really excited about the work that lies ahead and this opportunity that we have to support the campus community.
Well, and when you're ready to talk about those, you're more than welcome to come back and do that. And I imagine, too, you're very pleased to see how it seems like all we ever thought about was health was the physical health, but now we're so in tune with mental health and our overall health and well-being, like you're saying. That must please you as a doctor.
Yeah, it really does. And as I think about it, one of the things that I think about is just this period of time that we're coming out of with COVID and the impact it's had on folks' mental health. And we can't deny that. And we're seeing more and more demand for mental health services. So that's a challenge in and of itself. And the fact that, we have limited resources. And so it's going to take all of us, faculty, students, and staff, to address the current mental health crisis and to really support each other as we come out of this. Over the next few years, we're going to see a lot of students admitted who were in high school earlier on in the pandemic in the most critical times. And so we anticipate to see some more of those mental health challenges, but we also will be ready to receive those students and to support them every step of the way.
So, Dr. Travis, just sort of summarize what you'd like Spartan Nation to know about you and your office's mission as it gets going.
Yeah, so the bottom line here is we're here for you. We have an array of services, and although health changes at different times, it's really, a spectrum. Sometimes people will feel healthier, and then other times people will feel some sense of illness, maybe mental health issues. And our goal is to try and work with Spartans to keep them at the healthier end of that spectrum and to be there with services when there are fluctuations. The other thing I think that people should know about our team and our services is just from my early experiences here, I am so thrilled to be working with such a talented team of individuals who really stay up on best practices, are ready to provide services year-round to our Spartan community. And so definitely some exciting things coming ahead and,
Spartans will. So that's Dr. Alexis Travis. She's Assistant Provost and Executive Director overseeing the university's new University Health and Wellbeing Division. And it's, again, welcome to MSU, and thanks for telling us about this new division on the show.
Thanks for having me, Russ.
And I'm Russ White. This is MSU Today.